Good evening, everyone. Let me welcome all my viewers once again today on Beyond Sugar. It's always been a pleasure to be connecting with you for these live programs and bring to you leading doctors from across the country who can talk to you directly and answer the questions which you have in your mind. Today on Beyond Sugar, I'm very happy to welcome Dr. Nalla Perumal from the city of Chennai. So, welcome to the program.
Good evening, Mahesh Sanjeev. It's really a honor and pleasure to be with you. Uh,
Same here, sir, and same for our viewers as well who are very keen to watch you. In fact, we keep on hearing sir, a lot of chatter about diabetes and its related complications. And one of the things which people want to know is that what is the relation between diabetes and the heart disease. And today, we will be taking some questions from the audience on this subject, and we will be talking about that how a person with diabetes should actually be protecting his or her heart. But before I start taking questions from the audience, let me formally introduce Dr. Nara Perumal to all of you. He is one of the noted diabetologists from the city of Chennai. And after doing his initial graduation in medicine from India, he did his higher studies in diabetes care from the University of Newcastle in the United Kingdom. He is also a fellow of research Royal College of Physicians at UK. Currently, he practices as a consultant diabetologist at Swami Diabetes Care Center at Chennai, and also associated with some hospitals like Parshnath and MGH Healthcare. Let me, sir, straight away hand it over to you for your opening comments on this topic. That is it really required for a person with diabetes to take care of his heart? Are there any connections between the two?
yeah. See, diabetes, we all know it's abnormal elevation of blood glucose levels. Everyone knows about this. But why do we want to treat diabetes? Is it to control the glucose level? It is rather to preserve the quality of life. Generally, a patient with diabetes gets into trouble because of two organs mainly. One is the heart, and the other one is kidneys. Suppose if the person is free from these two ailments, one is macrovascular, the other one is microvascular complication. So obviously, the quality of life will be better. So the idea of treating diabetes is to protect the vascular system. So we have micro and macro vascular system supplying all the organs of the body. So macro vessels, the major blood vessels supply the brain, the heart, and the feet, whereas the microvasculature supply the retina of the eye, the nephrons of the kidney, and nerves. Diabetes, especially the high glucose level, can lead to either a blockage of the major blood vessels that is supplying the heart, brain, and the feet, or can damage the microvasculature which supply the retina or kidneys or nerves. So essentially, it's a vascular disease. So naturally, heart being an important organ, we should know that it's the first organ to develop. Even 3 weeks of fetal life, we have the heart's beating, and it is the last major organ to stop working. And you must know that heart beats about 3 billion times in our lifetime. So imagine, we take rest, we sleep, we enjoy our life, but the heart cannot stop. It need to keep pumping oxygenated blood throughout the organs. So diabetes being an inflammatory state, it affects the endothelial lining of the blood vessels, and it can affect the pumping action of the heart. By affecting the endothelial lining, inner lining, there could be a accumulation of plaque, which can cause a narrowing of the blood vessel, and diabetes also increases the risk for thrombus formation, the clotting ability. So a clot can form within that clogged blood vessel and cause a heart attack. When the cardiac muscle is not getting oxygenated blood to do its job, that is pumping, then naturally it is called heart attack. And if the heart starts straining, if the pump mechanism fails, it is heart failure. So the heart can get into two major troubles. One is heart attack, the other one is heart failure. So to preserve the heart function, we need to control diabetes from early on.
Okay. So thank you for providing this, overview about diabetes and the cardiovascular health and how heart can get affected, the inner linings can get affected because of diabetes. So I think I'm sure that our viewers would have got this general idea now that there is definitely a linkage between diabetes and the heart health. So as you mentioned that heart can go into two kind of problems, that they can be because of this inflammatory situation, it can lead to heart attacks, it can lead to heart failure. If you can also help us understand that, would every person with diabetes, would it lead to cardiac problems, or is there some group of patients who are at higher risk who may develop cardiac problems because of diabetes?
Yeah. See, actually, not that all patients with diabetes should end up in a complication. There are other risk factors. For example, race itself is a risk factor, ethnicity. So, Indians, Asian Indians especially, are known to have increased risk for coronary artery disease as compared to Caucasians. So, even though our LDL level, the cholesterol level is about 8 to 10 milligrams per deciliter lower than the Caucasians, we develop atherosclerotic heart disease about a decade earlier than the whites. And more than 50% of coronary artery disease associated deaths in India occur before 50 years of age. And 25% of myocardial infarction occurs before the age of 40 years. So, what I'm trying to tell you is Indians are susceptible to heart attacks, whether they got diabetes or not, at an earlier age than their Western counterparts. So, the implication is if we want to control diabetes or other risk factors like smoking can be a risk factor, being overweight can be a risk factor, leading a stressful sedentary life can be a risk factor, wrong food, so a lot of risk factors are there. So we need to address all these risk factors as a preventive strategy to stop getting into this trouble later on. So by the time when a patient develops some symptom, it may be little too late, especially in a patient with diabetes. So we know diabetes can drive atherosclerosis. So the diagnosis of diabetes itself should warn both the patient and the treating physician that we need to be more careful and more proactive about preserving the heart health.
Okay. All right. So I think it's a very clear understanding which Dr. Nala Perumal is giving to us, that diabetes and plus some other risk factors put together can lead to a bad heart health. So the next question which comes obviously is, now you said that the moment diagnosis of diabetes happens, you should be careful about these things. So is there any sequential impact on the multiple organs of the body, or is there any duration related guidance you have, that after someone has been diagnosed of diabetes, so after how many years the heart will start seeing its impact, a negative impact? So can you give some guidance around this to our viewers?
Okay. See, remember, there are two issues here. One is we diagnose diabetes late. Generally, someone gets diagnosed with diabetes, we are not sure that around the time when hyperglycemia happens, we are diagnosing accurately. Majority of the times, we diagnose it late because a person with diabetes presents with some other problem, or it could be a opportunistic screening, where he may be applying for an insurance or applying for employment, and there the screening happens and they get detected with diabetes. So we don't know how many years this person has had diabetes before. So the ticking clock hypothesis, it suggests that the macrovascular risk factors start operating well ahead of diabetes diagnosis. Say, for example, there is a pre-diabetic stage, IFG and IGT, where the blood glucose levels are slightly abnormal, not amounting to the diagnosis of diabetes. There itself, the vascular risk starts. So, when someone has got diabetes, we need to remember that the cardiovascular risk factors started operating well ahead of the diagnosis or prior to the diagnosis itself. So we are not going to lose any time. So around the time of diagnosis itself, we need to do a thorough cardiovascular screening. We are not going to wait for another 5 years or 10 years to start doing the cardiovascular screening. It should start at the point of diagnosis itself. If everything is normal, then it need to be individualized between the physician and the doctor when the next screening should happen. So let us be very clear on this. When someone gets diagnosed with type 2 diabetes, the cardiovascular health should be assessed at the time of diagnosis itself.
So essentially, what you are saying is that we should not wait for long duration after diabetes diagnosis has happened,
Yeah,
uh,
duration also plays a role.
because
Yeah, duration plays a role in increasing the problem of atherosclerosis and other. Obviously, the plaques can get progressing, and so that advancement of the disease can happen. But the problem of subclinical atherosclerosis could be there even at the time of diagnosis of diabetes.
okay. So what you are saying is that as the number of diabetes, years keep on increasing or progression is
That is
happening, so the
absolutely.
situation will keep on deteriorating probably. However, the onset may have started quite early as well. So can you also help, sir, our viewers understand that, now, for example, someone is diagnosed with diabetes and the initial investigations have been done by his doctor, and nothing serious has been found related to the cardiovascular health, but the risk is there. So are there any, signs or symptoms one should be looking out for, that if such signs and symptoms are there, so it can be a precursor to a cardiac problem for that person, and therefore he should be like little more vigilant and cautious about that.
Yeah. There could be, as I said earlier, there could be a problem of coronary artery blockage, which is coronary artery atherosclerosis, and there could be a problem of the pump. The heart, as a pumping organ, is failing. So the symptoms could be different. When the blockage happens to the arteries supplying the cardiac muscle, then the person can have a compressing pain or discomfort in the chest, which can radiate to the jaw or to the left arm. These symptoms are very typical. We call that as angina. Angina symptoms are typical, but sometimes in people with diabetes, especially longer duration of diabetes, because of the involvement of autonomic nervous system, the pain may not be conducted that easily. So the patient can have silent myocardial infarction. Suddenly, they may feel weak, unusually feeling as tiredness or fatigue, so or sweating without even pain. When someone is not comfortable, or some kind of gas trouble which is not getting better, then they have to seek medical help. So there are some atypical signs which could be a premonitory sign of heart attack, which a person with diabetes should be aware of. That is why during regular care, at least once in a year, we do a ECG. For high risk patients, we ask for a treadmill and echocardiogram just to assess the heart function. And when someone gets heart failure, they can find it difficult to climb stairs. Whatever they were doing, the normal kind of routine work, they find it hard to do it. Normally, they usually climb, say, 2 flights of stairs. Even after one flight of stairs, they feel little breathless and very unusual. They have to stop for some time, take some rest, and again climb the remaining stairs like that. So if they become breathless, or during sleep they are getting up in the bed to get good breath, they're feeling choked, then probably the heart is failing. Or if they are observing the urine flow is little less comparatively, or they are finding their feet swollen or face whenever they get up, especially in the early morning, when they look in the mirror, the face is little swollen, the eyelids are swollen, then it could be a sign of heart failure. So you have to immediately seek medical attention.
Okay, so I think look out for these symptoms and signs which Dr. Nala Perumal has just elaborated. And if you have certain symptoms which are indicative of these, then you should probably talk to your doctor immediately. And if these things are diagnosed timely, then the chances of taking care of these things and stopping the progression are far better for you. Sir, in this case, you also mentioned about that you recommend screening to the patients. So maybe, my next thing, if I may ask you, is that what is the role of screening out here? If someone has diabetes or someone even has a family history of diabetes and the risk factors are high, then do you recommend, some screening test or an overall screening for that patient? And if yes, then what should be the right frequency of this screening? And what are the common tests which should be done in such a case, in such screening?
Let us first talk about the high risk features. So, as I said earlier, all patients who get diagnosed with type 2 diabetes, they should have a proper cardiovascular screening around the time of diagnosis itself. Then, if they later on, as years go on, if they have some other features like a lipid profile is very abnormal, it could be a familial hypercholesterolemia, or they are developing nephropathy. We should know that when someone develops a renal problem, it can drive atherosclerosis. It's like there is a bidirectional relationship between the heart and kidney. Anyone with a renal impairment or kidney failure, they in fact develop a faster, rapid accumulation of plaques in the coronary arteries or other major blood vessels. So, chronic kidney disease and cardiac disease go hand in hand. And anybody with NAFLD, that is fatty liver disease. So, in a routine ultrasound, they get diagnosed with fatty liver, especially if there is fibrosis. Then there is a higher risk for atherosclerosis. Then people with central obesity, especially when you measure your waist circumference, if it is more than 90 centimeter in men or more than 80 centimeter in women, then they have a higher chance of developing a cardiac problem. And if the laboratory tests, some of the laboratory tests, like nowadays we do the highly sensitive CRP, HSCRP. If the HSCRP level is more than 2 milligrams per liter, or if the triglyceride level is higher, then obviously they are at a higher risk. And any women with history of polycystic ovaries, previous history of gestational diabetes, or preeclampsia, or any woman who has had a premature menopause, all these women have very high risk of developing a heart disease. So, assuming that these people have diabetes also on the background, when these features are exhibited, or this history, as you have rightly pointed out, family history of coronary artery disease. If someone says, in my family, one of my uncle died at 50 years due to heart attack, then that is a strong family history. Any family with a first degree relative, especially a male less than 55 years or a female less than 60 years, if they have had any cardiac ailment, then the other family members have higher risk of heart disease. So we need to look for the risk factors and start assessing these people. There are many ways of assessment. um, Simple thing is, you have to do a resting ECG. Then you can go for an echocardiogram, where you will be assessing the heart function, whether the pumping action is right, whether there is diastolic or systolic dysfunction, what is the ejection fraction, and how the valves are working. All these things can be ascertained with an echocardiogram. There will be some clues in echo itself. If there is a particular wall is not moving properly, there could be a wall motion abnormality. Then we can understand that this particular portion of the heart wall had ischemic episode before. So it's not working as well as it should. So echo some light on this, throw some light on this, and we can ask for treadmill, which is stress ECG, where the patient will be asked to walk on a treadmill, and electrocardiogram will be assessed in a real time. A cardiologist will be doing this, and during the treadmill, if there are changes, ST segment depression or other changes which point out towards coronary artery disease, then they can go for further investigations like coronary angiogram and cardiac evaluation.
So these are the some of the screening tests which you should be doing. And correct me if I'm wrong, sir, you recommended an yearly frequency for these. So once
Yes.
in a year, someone
Yeah.
should do it if the risk is high.
Yes, basic ECG. Yes, everyone with the diabetes should get it done at least once in a year. It's a very simple test to do. Takes about 10 minutes of your time, and it's non-interventional. It can be done in any even it doesn't require high funda equipment. So even small clinics, well-equipped clinics, they have
And
ECG.
what about, sir, 2D echo? Should it be done also as a routine every year or only on the basis of symptoms?
It's
What's
better
the suggestion?
to do it around the time of diagnosis, just to know the status. And then, depending on the patient's age, suppose patient is very young, there are no other risk factors, then maybe once in 3 years we can do. Otherwise, annual echo screening also can be done. It need to be individualized.
Okay. So essentially, I think here Dr. Nala Perumal emphasizes that the screening's role is important. If you have risk factor, if you have diabetes and other associated risk factors, then don't wait for the symptoms to occur because at that time it may just be very late. So it's better if you screen at a designated frequency as suggested by your doctor, and that will help you stay in the safe zone. And even if something is diagnosed, your doctor is aware, and immediately some treatment can be started. Sir, now we have discussed about this, but many viewers they want to understand, like you know that you have diabetes, and you know that it will lead in one way or another to complications, and especially the heart disease also. So, what should be done? Are there any preventive measures which can be taken, by the individual, so that either reduces the risk significantly or delays the onset of such problems in his life?
Yeah. See, for this, I think we have to go through the American Heart Association's 7 approaches to good heart health. It's a nice way of remembering things. First, being a diabetic, we need to start with good glucose control. Obviously, hyperglycemia drives everything, right? It increases the inflammatory, aggravates the inflammatory state, increases risk for thrombosis. So, obviously, your fasting plasma glucose, postprandial 2 hours glucose, as well as your HbA1c should be kept to the optimum level. So you have to have a discussion with your physician, individualize your target. You should know to what level I should control my diabetes. It may be differing from a person who is 30-year-old versus a person who is 76 years old. So definitely it need to be individualized. So first, glucose control. Second is a heart healthy diet. We may discuss it a little elaborately later. A good diet which is not going to cause any problem to the heart in the long run. And then if you're overweight or obese, try to lose your weight. This is the third one apart from diet. Healthy weight management. So definitely an attempt should be made to lose weight if you're overweight or obese. And then increase your physical activity. Whatever you're doing, you can increase your current physical activity. Now the recommendation is um, uh, previously it was 150 minutes per week. Now the 2024 ADA guidelines suggest that a healthy diabetic person should attempt to do 300 minutes of brisk activity every week. So they have doubled it, 150 to 300. So that means at least 60 minutes, 5 days a week. So at least 5 days a week, 60 minutes, 1 hour. So that should be done. So that is physical activity. Then more importantly, smoking cessation. So if you're smoking or using tobacco in any form, kindly stop doing it from today itself. It's very difficult. It's a habit. I know people struggle to quit the habit, but it is very important, critically important for the vascular health to stop smoking. And then if you have blood pressure, hypertension, you have to control your blood pressure to the optimum level. For most of the people, the optimum level is 130 over 80 millimeters of mercury. And finally, the cholesterol. If you have cholesterol level, you have to control, especially the LDL cholesterol should be brought down to now the recommendation, the recent Lipid Association of India 2023 guidelines suggest that it should be less than 50 even in a diabetic patient. Previously it was 70, now they have reduced it to 50 or less. So all these 7 factors, The A1C, a heart healthy diet, healthy weight, weight loss, physical activity, smoking cessation, blood pressure management, and cholesterol management. All these seven factors put together definitely will keep your heart healthy.
I think that's a very nice way of remembering the way Dr. Nala Perumal has helped us. Seven ways which you should take care of. And if you take care of these seven things, you can significantly reduce the risk or onset the delay of such problems in you.
Sanjeev,
You
I
build on,
add another two to the
yes,
list.
okay.
Just
Yeah.
sleep. Now, sleep deprivation is a big problem. A lot of shift workers are there. They don't sleep properly, don't get adequate sleep. That is also is affecting heart health. And then the other is sitting time, screen time. So again, it's affecting even children. So these two have to be addressed.
So, what is the ideal screen time and what is the ideal sleep time, sir? It's a very, I know a
Sleep.
lot of people will not like your
Sleep
answer, but still, tell us.
Sleep, I can tell you. See, a minimum 7 to 8 hours of sleep for most people. The minimum is 6, but 7 to 8 hours is ideal for most people. But screen time, sitting time, nobody knows for sure. It's better to actually take a break. Say, if you are working in front of a computer all the time, maybe every 1 hour you can take 5 minutes break, just walk around and again sit in front of your computer. That helps. Right? Break your sitting time and screen time.
Yeah, very, very important things. Generally we only attach these things to our eye health, but it's not related to your eyes only. It adds to the overall, the stress paradigm, and then which leads to a lot of other complications as well. And take some, good 7 to 8 hours of sleep
Yeah.
as well. Don't go out for the binge watching of on the OTTs, and so take care of yourself. That's important. So you wanted to dwell a little more on, how do you guide your patients on a good dietary, management in such situation, and also what kind of active lifestyle, they can have. So if you can dwell a little more on these two things for our viewers for better understanding.
So actually, diet is very very important. Everyone knows for sure, but it is the most difficult advice to follow, because changing someone's habit. We talk about lifestyle modification, but it's not very easy to do that, because lifestyle one someone's lifestyle is learnt over time, no, from childhood we are used to some kind of lifestyle, and changing it just because you develop diabetes or you get diagnosed with a heart disease becomes a big challenge for most people. But we have to do it. There should be a family support when we talk about lifestyle changes. Unless a family is rallying around the person with diabetes, it's going to be very difficult, because the cooking happens for the entire family, not only for the patient. And the second point is high carb diet. We Indians are known to consume high carb. So there are good studies from Pan India studies which have suggested that all over India, whatever the cuisine is, we consume about 65 to 75% of our food intake is from the carbs, and it can easily raise the triglyceride level, which is again a cardiovascular risk factor. And Indians have atherogenic dyslipidemia. That means we have got high triglyceride, low HDL, there is good cholesterol is low, and there is a high level of small dense LDL, which is highly atherogenic. So all these factors could be triggered by our poor eating habits. One problem is reheating of oils, which generally in a lot of homes they do, and partially hydrogenated fats, or higher heat cooking. So we use a lot of heat, to cook our food, and that can cause reactive oxygen species to form. It can affect the liver. It can increase the fat content in the liver. A lot of theories are there about why Indians develop fatty liver even if their BMI is within normal range. So this could be one factor which is driving insulin resistance. Remember, insulin resistance is one of the factors which drive atherosclerosis also. And saturated fat content should be reduced. It should be less than 7% of our total energy. And we have to avoid trans fat, because we eat a lot of trans fat, especially hotel food. Majority of it is from trans fat. And avoid fried roasted food in general. It's better to cook by grilling, baking, or steaming. These are all safer cooking practices. Steamed food is always good. And try to consume whole grain cereals rather than processed foods. Anything which comes through the machine is processed. Anything which comes in a packet with an expiry date probably is processed. So we need to avoid such things. And less refined starch, all sugar sweetened beverages, because that either contains direct sugar or fructose. We need to avoid that. And direct sugars in any form. A lot of people believe jaggery is okay, white sugar is bad. So any sugar, especially taken by a diabetic patient, can increase the glucose level and make the job of pancreas to secrete more and more insulin, and it starts struggling at some point. And protein should be from lean sources, and fiber content should be increased. A lot of points I've told, but these are all practical tips which can be implemented easily in the home front. With the help of good dietitian, they can do. Generally, Mediterranean diet, where they consume a lot of fruits, nuts, seeds, legumes, and fish. This kind of diet is also good for someone who is taking non-vegetarian food. Predominantly fish might be a good option for the heart.
Okay, so I think these are a lot of things around diet which Sir has informed us. Just in case you could not recollect everything, or it's too much for you. The good news for you is that this program is going to stay here at this link. You can always rewind this, hear him again, and understand some of these important things which can be very very vital for a good overall health of yours. Since we're running out of time, sir, I'll take one last question from you before we conclude. And that is like, for a patient or, someone who's having diabetes, is generally in touch with his family physician or his diabetologist. When is the right time for, a patient to meet a cardiologist, specifically, to for a good cardiac health, or any issues related to that? Is it you generally recommend a patient to go to a cardiologist, or are there certain thresholds when he himself should decide? Any thoughts on this?
Yeah. See, whenever a person with diabetes develops a target organ damage, if they have multiple cardiovascular risk factors, let us just define target organ damage. We define target organ damage as any calculated EGFR, that is, with creatinine level. We have got good GFR calculators in the net. Your doctor will be able to calculate it, or yourself can do it. If you know your creatinine level, age, and gender, then you apply these factors in the formula, in the calculator, in the net, and you can derive your EGFR. If your estimated glomerular filtration rate, what is the estimated glomerular filtration rate? That is, both the kidneys together, they are able to filter how many ml of your blood every minute. So it normal is more than 90 ml. So the normal value is more than 90 ml. If someone's calculated EGFR is less than 45 ml, then they have a very high risk of developing an atherosclerotic lesion in the heart or other blood vessels. They have to consult a cardiologist. Or if the GFR is between 45 to 59, and there is evidence of protein in urine, microalbuminuria, or if the urine is full of proteinuria, or if they have got 2 3 microvascular risk factors, like someone who has got diabetes along with nephropathy, neuropathy, and retinopathy, like that. So if they are exhibiting 2 3 target organ damage, then they have to consult a cardiologist. The other risk factors are someone who is smoking, who is not able to quit smoking, then they have a higher risk. Or someone whose blood pressure is not coming down even after a combination therapy of antihypertensives, the BP is not coming down. Or if they have got a very strong family history, then probably proactively the diabetologist or the treating physician should refer to your cardiologist for a better cardiac evaluation. Remember, cardiologist is a super specialist. So obviously, no harm in taking their help to assess the heart health at least once. So if there are multiple risk factors apart from diabetes, or if someone develops some symptoms pertaining to the heart, or if the ECG shows some changes, or echocardiogram shows some reduced ejection fraction or some problem, then it is better to consult a cardiologist, get their opinion, and then continue with your physician's advice. So they can coordinate. Both the doctors, specialists can coordinate and help you. That's a better
All
way of.
right. Yeah, I think that's a very, very specific guidance which sir has given us that when you should be meeting a cardiologist as well to take advice. It's very important in diabetes that not only you manage your blood sugar levels well, but end of the day, it's not the hyperglycemia or the blood sugars only, which is the ultimate aim of treatment of diabetes. The ultimate aim for treating of that treatment of diabetes is to safeguard your organs and keep them healthy, and heart being one of the important organs in the body, as sir also mentioned, the complete process that and the way how we should be careful about it, how we should be diagnosing any potential problems for the heart, how we should be screening it. And also he told us that that seven way approach, 7 plus 2, the 9 things which he told us to maintain a good cardiac health. I think, sir, I must thank you here for taking your time today and talking to our viewers in such an elaborate way on how, if someone is having diabetes, how he or she should be working towards protecting the heart and what are the things to be done. I'll thank all my viewers as well out here who joined us live or who would be watching this program later on. In case you have anyone in your family or in the friend circle who is having diabetes, so this discussion can be very, very useful for them. You can simply share the link of this program with them, and they can be benefited with whatever guidance today Dr. Nala Perumal has given to us. But before I conclude, I must hand it back to you, sir. That in case you want to say any final words to the viewers, or anything important which you have still missed and you want to emphasize.
Yeah. So if someone has got diabetes, don't lose heart. So it's always easy to follow certain healthy lifestyle. Only thing you require little more motivation, probably family support to do that. So involve your family members. Suppose if you want to walk, ask your wife or husband, your partner to accompany, so that it makes it easier for both of you to have a healthy life. So have a healthy lifestyle first, and if you're smoking, quit smoking. And there are good drugs now. For want of time, we couldn't discuss this during this discussion. Actually, if your doctor has prescribed a class of drug called SGLT2 inhibitor or GLP-1 receptor analog for cardiac benefits, not only for controlling diabetes, continue those drugs. Don't become a dropout. And if you're on aspirin, or if you are prescribed statins for cholesterol, never stop it without doctor's advice. And activity we have discussed, be active, and never miss your screening appointments. Always stick to the time schedule, because it's all about preserving your health, and control your diabetes, your blood pressure, your cholesterol. Take your medicines regularly and follow a good lifestyle. That should be enough to keep your heart healthy and beating for a lifetime. Thank you, Sanjeev,
That's
for
great.
this
Thank you
opportunity.
so very much. Thank you so very much for taking your time out today, sir. And it's always a pleasure to be hosting you here, and our viewers listening to you. So I think on that positive note, which Dr. Dalla Perumal told us, that if you have diabetes, don't lose your heart. Protect your heart, stay motivated, and follow the guidance which he has given to you today. With this, thank you so very much, and we wish a good night to everyone. Thank you, sir, for today's program.
Thank you.